They get a bill, but it doesn't really have the breakdown that's needed. And there's concern that, there have been national studies showing there is waste, fraud, and abuse in the healthcare system, maybe 15 to 30%. So without being able to see the itemized bills, it's difficult for the state health plan directors to know exactly what they're paying for.
Is there any involvement here for the General Assembly, or have we heard any feedback from legislators? One would presume that people would be on board with the general idea of the more transparency, the better.
Well, you would think so. The treasurer has proposed a plan. It's called reference-based pricing. It would put the amount they reimburse the hospitals and the doctors based on Medicare would be a certain percentage above the Medicare rates that the government pays. He thinks that's a very important part for controlling costs. However, I'm finding out today that there are some lawmakers on healthcare committees in both the House and Senate who are working on legislation to prevent the treasurer from implementing his reform plans.
Why?
Well, if they'll call me back, I'll tell you. I haven't had any luck
That's
yet.
a real head scratcher, because it implies that something else is going on. And the treasurer, it seems, is trying to just extract information, since, again, public dollars are being used to pay these bills. So he's trying to find out more information, and yet there is some sort of effort to prevent that.
Hospital lobbyists, in 2 words. They're a very powerful organization down there. They often twist arms among the lawmakers, and they are being very aggressive on trying to prevent the treasurer from implementing his reforms. He's made no bones about telling them in face-to-face meetings that under this plan you will get less reimbursement. We have to do that to save the state health plan. The State Employees Association agrees with him. They think that there's a lot of cost shifting going on. State health plan members are helping to pump up the hospitals unfairly. So it's a big fight.